Today we are going to see part 3. Gastroenteritis involves vomiting and diarrhea. We are going to address 3 questions for diagnosis, consequences or complications, treatment, and prevention. We start on the question of diagnosis. How do you know that one has gastroenteritis? Before you go to sign and symptoms, you need to check history. What food was being consumed prior this diarrhea? Was the child in the daycare center? Was there any antibiotic exposure in the past? Then you check physical signs. The patient, whether a child or adult, might have lethargy. That is the extreme weakness, dehydration. That's a very serious sign that will cause more damages when we talk about gastroenteritis. There will be decreased urination because the water is getting depleted in the system. Mental status changes. Dehydration will also affect the brain. Dry mucosa. The mucus will be dry. And severe pain, the cramps, because of these bacteria, viruses, they will be damaging the intestines. Now there will be nausea, abdominal cramps, pain, vomiting, and fever, is possibly fever, and headache. Now, because the diarrhea is ongoing, passing stool, more than 3 times a day, sometimes it is worse than a person will stay like in the toilet every minute. For children, it can be very severe, where when you check, you examine the child, might be having a sunken fontanelle. The child cannot cry. The tears are dry because there is no water. The mucous membrane will be dry. You can see even the skin will be like an old person. That is severe dehydration. What are the consequences of gastroenteritis, or what are the complications? So the complication will affect the whole body. Dehydration, remember the water will start getting depleted from 70% going downwards. Sometimes can be even worse. The kidneys will be affected, the mental condition, there will be weight loss. So all the parts of the body will be affected. Now, the kidneys with dehydration might cause the formation of stones, kidney stones, because the dirt that are supposed to be eliminated with water, now they are not being eliminated. Formation of stones, kidney stones, and infections that will lead to kidney failure. Seizures, electrolytes are very important in the system, in the body. So once electrolytes are decreased, it can lead to seizures. That is fitting. Hypovolemic shock. Hypovolemic shock and systemic infection, especially when there is like a salmonella infection, then it can spread even to the brain and cause meningitis. Hemolytic uremic syndrome. Hemolysis is a destruction of what? Red blood cells. Why? Because the toxins will be too much in the system, then start destroying the blood cells, then cause hemolytic uremic syndrome. You can see now a child who has been previously well, severe dehydration in a very short time, the child might even die. It is estimated that in 2015, 2 billion cases were reported of gastroenteritis, which resulted in 1.3 million deaths. You can understand how bad gastroenteritis can be. And the children and those in the developing world are the mostly affected. We can understand the impact of this gastroenteritis worldwide. Now, we need to pay attention, a very serious attention, on pregnant women, little children, elderly individuals, severe abdominal pain, and patients who are passing bloody stool or rectal bleeding. We need to pay attention in these cases. If there is a severe volume depletion, a very severe dehydration, if there is comorbidity, like immunocompromised people, anything that lowers immune system. Abnormal electrolyte and renal function. If the kidneys are shutting down, we need to be careful. Or prolonged symptoms, if it lasts more than 2 weeks, we need to pay attention. Women who are pregnant, it is known that they have 20-fold increased risk of developing listeriosis. This bacteria, the listeriosis that might come due to consuming unpasteurized milk or poorly prepared meat, they are at risk of having a very bad infection with listeriosis. Let's see the treatment and prevention. The treatment number 1 is rehydration. It's moderate. You can give oral rehydration, but when it is severe, you need to go intravenous. You need to give minerals like zinc, which will help a lot in reducing the duration of diarrhea. Then you give food, which are very rich in proteins and vitamins. Then consulting a health worker. You don't stay at home when things are becoming bad. If it is moderate, you can do oral rehydration treatment. But for severe ones, then intravenous is needed. This is how you can do it. Mom who at home, if your child starts like having a diarrhea, before you go to hospital, you can start doing something. What do? You boil water 1 liter. 1 liter of water, you put 6 spoons of sugar. A teaspoonful, you put 6, then you put half level of teaspoon salt. Then you mix, then you start giving to the child. Every time the child vomits or passes stool, you give. You give little by little until you can now reach hospital, but having done something. This have saved many children, but something needs to be done. You need to start from home. And when you arrive in the hospital, depending on the severity of dehydration, then treatment will be used intravenously and rehydration will be done as well. There are proven ways to save lives. The treatment appropriate with oral rehydration is number 1. Then you add antibiotics if there is an indication. Training health workers is very important. The healthcare providers. You educate mothers and care workers on how to manage this condition. Then building health facilities, clinics, hospitals, laboratories, it is very important. Then vaccination. Vaccination is very important, as we know that rotavirus is among many causes of what? Diarrhea diseases. Providing safe water, adequate sanitation, and human waste disposal. We have seen in the part 2 in our presentation the causes of the gastroenteritis. We need to address those causes. Then we need to promote hand washing with soap. Breastfeeding is very important for mothers, as you are giving immunity. You are giving antibodies, soldiers of the body to the baby. Travelers' diarrhea. For people who are traveling, if they develop diarrhea, where they can even have pus coming into diarrhea, fever, blood, or mucus in the stool, antibiotics can help a lot. They need to be treated. We need to know how to maintain our food, how we clean it. We need to always consume things that are well cleaned. We need to train children when they're still young the importance of what? Hygiene, washing hands regularly. Dear friends, African people, many African countries still have this kind of life. People are fetching water in the dams, in the lakes, in the dead water, and they consume immediately. You can see what's going on in the red zone in Africa, particularly sub-Saharan Africa, red zone, where the mortality rate due to diarrhea is very high. In some countries of Asia, Dear African people, may we please do our best possible to change this. May we do our best. And ask as well those who are in the green land and, the better places, may you please come on board and help to transform this zone. Thank you for being with us again. Health education, health promotion always. Thank you.